Welcome to Access Amplified, the podcast where we shine a light on how digital health is increasing access to care and advancing equity around the world. I'm your host, Joanna Brownold, and our podcast is brought to you by Taito Care. In each episode, we sit down with healthcare leaders who are doing the work, not just reimagining access, but rebuilding it from the ground up. Today, I'm joined by Chrissy Kuahine, Director of Techquity at Waianae Coast Comprehensive Health Center in Hawaii. Thank you for joining me today, Chrissy.
Aloha kakahiaka. Good morning, Joanna. Thanks for having me. I appreciate it.
I'm so excited for our chat today. Your health center serves a vibrant but underserved community on the west side of Oahu, which is Hawaii's main island. And we're going to talk about how you're delivering not just healthcare, but true community support, especially in a region where digital access can't be taken for granted. And one of the things I love about the work that you're doing is it's so creative and thoughtful. And, I think really this episode is going to be all about what it means to close those care gaps with creativity, with cultural humility, and with community roots. So let's get started. Chrissy, can you start by painting a picture of the coast, of where you live and the community that you serve, and what makes this region both complex and unique from a healthcare perspective?
Sure, absolutely. I think you hit it on the nose there in the introduction when you started to describe, right, that as a community health center, I think all of us, what we have in common is we serve a vulnerable population. In our case, what makes it unique is that majority of our patients are of Native Hawaiian descent. So you definitely have the cultural aspect. And then you think about, if anyone knows Oahu and the west side, geography also poses challenges. We're one way in, one way out. We have the challenges, of course, of hurricanes and natural disasters, wildfires, those kinds of things. But what really makes it difficult is the socioeconomic challenges that our population faces. I think there was an article that just came out painting a picture of what you would need to live in Hawaii.
Okay.
And that's just to go to public school, not anything fancy, but at least $100,000 for a family of four annually.
Wow. Per year.
Now, yeah, imagine this: is 70% of our patients here at the health center live at or below the poverty level. So on average, their annual income is anywhere from $18,000 to $25,000 a year for a family of four.
That's a huge gap.
That's a huge gap. And so really our focus, our mission is, of course, to serve those regardless of their ability to pay, regardless of their medical status, regardless of their insurance. And so we serve close to 38,000 unique patients per year with over 220,000 visits per year.
Wow. Okay.
So getting back to what you were saying earlier, right, as I talk about those challenges, I think it really kind of forces us to be innovative and think creatively when it comes to how do we fulfill our mission. And then, of course, for myself, born and raised in the community, how do I do that really? Because I want to, I'm serving my family, my friends of friends. We're 50,000 plus, but really, we've all been here. If you've been born and raised in Waianae, you kind of know everybody. And so we have all of that, I think, going for us, despite the fact that we have all these socioeconomic challenges, as well as I'm going to just slide it in there, the historical generational types of trauma that happened with the overthrow of the monarchy, which can be saved for another podcast day.
Absolutely. And we often chat and we often have those kind of background informations, and I always learn something every time that we speak. And I think, as you said, the community is a strength where you are, and you're really playing to that strength, and you're really kind of focusing on that strength, because the work that you're doing is more than that of a health center, and you're also providing community services. Can you tell me a little bit more about how you're going beyond primary care to really provide a safety net for the community?
Absolutely. So I've been at the health center now for 35 years and worn many hats. But what I've been consistent, believe it or not, for over 30 years is data collection. Isn't it wild? So as a community health center, now think about it, 30 years ago with internet, very new, our computers were still, at least here at the center, were like DOS. So everything we collected on paper now, you might ask, well, why were they thinking about data 30 years ago? And it goes back to your question on how did we even know that beyond the medical services that you provide to your patients, how you paint how that picture at the end of the day for that particular visit is diagnosis codes, your
Mhm.
CPT codes, and then your eval and management codes. But we knew as a health center, think about what I have described, and think about all those challenges. How do we really provide to the peers a true comprehensive illustration, right? A picture of the complexity of our patients. And so what we started doing was we created codes 30 years ago, so similar to CPT codes, but we codified everything that we do that is not recognized or reimbursed by the peer. But we know
Okay.
that it adds value. We know that the outcome then would not only be healthcare, but quality healthcare, better healthcare outcomes. So things like arranging transportation, interpretation, talking with the family about the medications that the patient is on or the new one that the provider just gave. That can take anywhere from 15 minutes to a half an hour because now besides the meds, you're trying to explain what the referral is for and how you're going to get that person from Waianae to town. And
Mhm.
so we codified all of that. That's the enabling care services that you mentioned, and we've been doing that for 30 years. Now, fast forward to 2020 when we purchased our EMR system,
Okay.
and then fast forward to our present. For those in the data world, I'm sure they're super excited about what I just said because what they're
Well,
thinking is,
35 years of data is an insane amount.
yeah. And then you combine that with EHR data, you combine
Mhm.
that with, payer data, and then we could, then go on to AI advanced analytics. And maybe we'll get a chance to talk about that in terms of innovation and how we're using that to help our community.
So, I mean, you've got all of this data, and you've been tracking your patients and your community for 35 years. I know that there is a lot of digital exclusion in your community. So, can you tell me what that looks like and the impact that that has on your community?
Absolutely. So when we just did the fast forward into our digital world. And for you and I, for those watching the podcast, I'm going to say out the door, we're privileged, right? Because the thought of not having a cell phone, the thought of not being connected, that's absurd. Everyone is connected. I mean, I'll be the first to say it. There was a moment in time before COVID, right before COVID, when I thought, okay, no, what if we were thinking about telehealth, and it never crossed my mind on the actual access part. Mine was about how do we instruct patients to, know what link to click or how they're going to adjust. The thought that there are still folks in my community that just don't have internet access either because of our geography. There's literally no fiber. Yes, that still exists. And affordability. That's really affordability is the huge the barrier that exists for our patients. And so how we identified that was really through COVID. And now I'm going to go back to the ability for us to think in innovation and think, just how everybody did really in COVID and going from in person to televideo or telephone for those that could not connect via televideo. But what I'm getting at is we were able to very quickly think about what data we're going to start to collect so that it can
Mhm.
be useful, not only for obviously operations, but then we start to think what folk, why, if they can't get connected full televideo, what is why? There has to be a reason. And
Yeah.
so, literally overnight, I'm not exaggerating, literally overnight, we adjusted our EHR system to be able to collect that data. So, when a
Okay.
provider was connecting with their patient and it was telephonic, so just telephone, provider had a drop down list, or still does, has a drop down list for the reasons why. So, either I don't have connectivity, I don't know how, I prefer not to. And, for behavioral health, there are quite a few patients that decline full televideo. But so now we're a little over 5 years worth of data. And what has been consistent, and actually in my mind, still very sad, we have still a double digit, anywhere between 10 and 12% of folks that have no internet access
Wow.
at all.
That's a
But a
huge
vast
number.
majority, oh, that is right. If you think about right now in our day and age and the thinking that and the advancements in AI, and you still have folks that now
That
in my
don't have
mind, what that
basic.
equates to, right, is they're being left behind
Yeah.
in so many ways. I mean, it's not, we know internet is not a luxury. I mean, and now I'm talking about healthcare, right? In order to have this really great, I think for most providers, most patients, they want to see each other because you have those nuanced kind of interactions, especially think about it. A patient is in pain. You can kind of see them grimace and then have, as a provider, a better way to determine what the patient is describing, but maybe
Yeah.
really what they're feeling. And
Yeah.
so that data has really helped us. We go back to our care enabling service codes that we've created. In 2020, we created 4 codes that identify digital access needs. And so, there's if we've assisted them with a referral, there's a code for that. For a digital device, or if we've assisted with digital literacy, then there's a code for that.
Okay.
Right. And then remote patient monitoring, there's another code for that. So getting back to digital inclusion, I just described the first 2, right? So there's the access issue where you just don't have any access. And then you have access, but you don't know how to use it in a meaningful way. Telehealth, the meaningful way is how to even log in. I remember helping patients, my mom, one of them, her very first telehealth video. Now she lives with me, so she should have just been like connected. But
Yeah.
she's Kapuna in Hawaii. Kapuna is elder. And so I said, okay, mom, when it gets to the birthday part, you have to put 2 digits for days, 2 digits for months, 4 digits for years. Now you and I think, easy peasy, we do that for everything. I mean, we have to think of like these 12-letter passwords,
Yeah.
mixed characters and all that. Well,
Yeah.
she was yelling from her side of the house, I can't get on. This is junk. I don't like it. And as I walked away, I said, how did you put in your birthday? She went, yeah, she's
Let
an
me do those
August baby. So she just did the 8. And so, of course,
8.
it threw it
Yeah.
off. It's missing a number. And so if you think about that part of what digital inclusion involves, right, is does someone know how to use their device and to be able to get connected, in this case
Mhm.
with telehealth? And then the third part of it is, again, now even beyond getting connected to your provider, I want to make sure my community knows how to use what they have, their device and their connection, in a meaningful way that includes telehealth, job opportunities, education opportunities. For Kupuna, is being able to get connected to Medicare. It's all online.
Mhm.
Now
And
think
they've
about
gotta
that,
work
trying to
out
get on
how
an
to connect.
online, right?
Right.
Online website. And then if they do have a place that they can go to, we have one place here on Oahu, they're waiting 4 to 8 hours a day to
Wow.
try to get in to see someone because of
Wow.
the staff shortages. And
Wow.
so I just kind of mentioned a bit about the essentials.
Yeah, no, so I think that kind of weight and the digital challenges there, first of all, you made me laugh with your mum because I had to set up Zoom for my mum. She's a teacher and she had to get on Zoom for the first time and we weren't allowed in each other's houses. So I was trying to get her to set up Zoom without being able to see what she was doing. There was a lot of shouting that
Yeah.
went down. So, this kind of
Yeah.
digital literacy, I mean, it's not something that we consider when it comes to kind of basic, like, let me make a video call. But, I want to talk a little bit about how you responded to some of these challenges because you have amazing programs. And again, like, you were speaking about, training and helping people with their access that goes beyond healthcare. So I want to start with the kiosks that you run and how you're using them to provide healthcare. But then I know you're also kind of leveraging them for other things as well, which is one of the things that I think is really special about the work that you're doing. So can you tell us kind of a little bit about that?
Absolutely. And I really love sharing this story because I always feel like, regardless of what state you're in, what community you're in, what country you're in, it's very replicable. And so
Mm-hmm.
what we did was, we knew that there were folks who they don't have the access, whether it's fiber and or we don't have very many cell towers in our community. So you truly just don't have access. And so we started to think about what place, right? Where does everyone have to go? Where does everyone kind of gather? Because we want to meet people where they're at. And so, hey, the grocery store.
Yeah.
So we opened up a telehealth kiosk in our local grocery store. What makes it unique, and so hopefully if folks are starting to think, wow, that's a great idea, is number one, we turned it into a full-fledged clinic. And so we have a agency here in the United States, HRSA, that we go through designation process. So it is a designated clinic site. Our little 10 by 10 telehealth kiosk booth, but it's right outside or right adjacent to our community pharmacy, which we own. So, I mean, that's already a match kind of made in heaven. And then you stick that into a grocery store and hey, talk about one stop shop. And so with the HRSA designation, we're able to provide transportation for our patients, not only kapunas, so not only our elder, but anyone in our community who has an appointment at the kiosk. Then they can see their provider, go to the pharmacy, go get their groceries, and then go home.
Mhm.
So if you think about being able to treat a patient in a holistic way, and then what you're alluding to, as far as what I think, it's, I say telehealth kiosk, and people are like, oh, that's kind of cool. That's great. But really what makes it special is it's not only a telehealth kiosk. We have a patient assistant digital outreach worker who is stationed there who helps with telehealth kiosk. But really, the other part or really beauty of it is our patients or people in our community. Now, mind you, they don't even need to be our patients. They can walk in and we can help them with those essential social services that are needed. So do you need healthcare? We can help you with that. We can start the process. We work with our state Medicaid program directly online. Do you need housing, rental assistance, utility resources, digital resources?
Right.
Are you being excluded? And so we can assist with that. So if you think about that combination, that really makes it more unique than a CVS or Walgreens type of telehealth where really you're seeing a provider and that's it.
It's also tailored for what your community needs, which is,
Yeah.
it's not just, as you said, it's a one-stop shop. It's not just a one-stop shop for your healthcare needs. It's a one-stop shop for the community to get, the range of benefits that they need. And that's really, I mean, what I love about this idea is, okay, I need healthcare access, I need food, I need my medication. And oh, look, there's somebody standing right here who can help me with the application that I didn't know how to fill in or whatever it would be.
Yeah, absolutely. And quite honestly, that's probably the hardest part is trying to navigate any government system, right? When you're needing those kinds of social services and why we place so much importance on that. And this may be lost on some folks, but it happens all the time. And I've been here 35 years. I worked as an MA when I first started. So I saw it all the time. Someone with, diabetes type 2 out of control, high blood pressure out of control. And you would think they need to focus on this, right? I mean, this is dangerous. But if they're trying to figure out how they're going to pay their rent, they're trying to figure out how to put food on the table. I will tell you right now, those medical conditions for them are not high on the priority list.
Right, absolutely. And by the and that what I like about this is also it's kind of a full circle, right? So you're helping them with the basic stuff, which gives them more mental space to focus on the healthcare issues. And also we know that, living conditions are going to impact your medical status. We know that, food, housing, education, all of these things. So you're by creating this kind of circle of services, you're improving their healthcare as well.
Absolutely. So what you're describing is right, those health related social needs that are typically overlooked, but over the years, it's been shown that all of those, whether it's education, housing, food insecurity, obviously, kind of Maslow's hierarchy of needs, those have to be satisfied
Yeah.
before anything else is going to happen. And so, and then you just put in the mix of all the other challenges. And so we pride ourselves in really being able to take a step back and see the importance. Well, obviously, I think, of 30 years of data, I think we've shown how important that is. But I think, the other thing that for our community, what really intrigued them too about and how a telehealth kiosk work because there's no doctor stationed there, right? And so we use Title Care to be able to bring in that remote physical exam feature. And that has been truly a blessing for many of our community members, our patients who cannot make their way to a provider, but they can certainly make their way to the grocery store. And not only see primary care, they can see their clinical pharmacist for medication management, for anti-coag, so common patients, as well as registered dietitians. Now, that to me is a marriage made in heaven, right? You
Yeah.
see a registered dietitian who gives you this list of like, really, you should have this for the, and go right out into the grocery store.
You're in
You
the
have
store.
your
Right.
list and it's right there.
Yeah. That's the perfect placement. It's like product placement dream. Do you mention that so where is the clinician sitting? Are they still in Waianae? or
Yeah, so they can they'll either be at our main campus clinic, or we have several satellite clinics,
okay.
including school-based healthcare. And so quite honestly, with shortage of physicians, as many of our community health centers, as well as really just all around the country, the shortage of providers at every level, whether it's MD, NPs. And so we really had to be able to use our resources and place them wisely. I mean, our scope based clinics, we don't typically have a provider sitting there physically. They'll be in one of our clinics. And using Title Care, we're able to connect those providers with patients that either with an appointment, so folks can make an appointment with their provider at the kiosk, or they can walk in. So, you have that option, and that's really the beauty. So, if we're talking location, any location in terms of distance can be miles away.
Mhm. That's great. So then you're also dealing with those clinician shortages as well.
Hmm.
One of the stories that we've spoken about in the past is your Kupuna computer literacy course. And I'd love if you could share a little bit about that because, again, this is just, I think it's just such an imaginative and creative way to spread better care and wellness through the community.
Awesome. Thanks for reminding me about that because uh, actually we have another one coming up next month.
Yeah.
So we our
I'm
target
gonna send my mom.
population that
I'm gonna
was
send my mom into Hawaii and
yes, come on. We'd love it. Wait, you're gonna be excited about this. This is gonna be something new. Hold your seat on this one. So the computer classes or digital literacy program that we focused on in 2023 was with our kupuna, so our elders. We knew that there certainly was a need. They couldn't go out of the house, as you mentioned, right? Everyone was locked down, but they still needed to see their provider. While many of them did have, they do have cell phones because, of course, their families set them up. And again, their
mhm,
families set them up. So they don't know their password to their email or that kind
right.
of thing. And they know how to answer a call and maybe respond to a text. So when it came to giving them the confidence and the know how to get connected with their provider, that really was a stretch. And so what we ended up doing was we have a big meeting area. And so to meet the COVID restrictions at that time, we had them with seating, we provided transportation. Of course, I got food. I got the right instructor who worked with Kapuna, and we coined it a computer 001. It wasn't even a 101 because we knew we not only thinking of digital literacy competency level, but
Mhm.
we of course had to think culturally, right? Our Kapuna based on native Hawaiian culture, if they're not following along or don't know something, they don't typically raise their hand, right? So
Okay.
we had to factor that in. Go slow, have someone next to them, a digital navigator who already works with our community. So these were our caseworkers who just by body language and by the look on their face, right, they know auntie needs help. Right. So I'm going to
Okay.
go over and I'm going to ask her, and I can see that she's kind of, 3 steps behind from where their
Okay.
instructor is. So there's certainly that. Of course, we started every session with Native Hawaiian culture. It's a pule, either a prayer or an oli, which is a chant or a song just to get everybody in the right frame of mind, open up our minds to new knowledge. And then we started from there, very basic. For most of our kapuna, that was the first time they ever turned on a laptop, and we were fortunate enough to get free refurbished laptops, which at the end of their training, they took home with them. And
Amazing. So
so,
you're also
yeah,
cooking them.
yeah, exactly. It started off as supposed to be only one 3-hour session. We ended up with 3 3-hour sessions. I mean, on different days, because and then we ended up. Speaking of Zoom, we ended at the end of the program with everyone on Zoom. So picture this: 20 kupuna in one big dining hall, all on the same Zoom
Same Zoom.
session, and sending each other reactions, hearts, and and then they're looking at you can see me now. Literally, their friend is right across the room. You can see me. I
I
can see
love it.
you. Hey,
Oh
so
my god, that's
talk about
adorable.
strong bandwidth right in the room. But it was
Seriously.
that, and I think what people fail to remember is we're really, I mean, especially now with all the fraud and scam going on, right? We're always telling our kapuna, don't click the link.
Yeah.
Now how do you get connected though with your provider? Now, we send our video platform, including Telecare, will send a notification either by text or by email. They have to click the link. And so part of the right digital literacy education was not only getting them connected, but also helping our kapuna to identify really the right link to click.
Okay.
And so that what we're doing next month is really going to be a focus on, we're going to start off with a half an hour of Medicare, how do you get connected to Medicare. And then the last hour are going to be focused on how to identify fraud and scam. And what you're going to be excited about was I got hooked up with a program called Tech Savvy Teens.
Okay.
And it's a nonprofit. It's a mom and son during COVID. The son realized he was helping all his, kapuna aunties and uncles to get connected. And so he told them, Mom, why don't we start something, a formal program? He's 15 years old. So he was, 13 at the time, that we can start to help more people, not only the people I know. So it's called Tech Savvy Teens. They go through the certification process. The teens do. So it's open from 12 to 17 years old. And at the end of the day, their mentor, their coach will bring a group of these kids and meet up with Kapuna either at elder living facilities or at the mall. And they'll sit one on one. They can sit with them for up to 2 hours. And the Kapuna will bring a list of the things that they want to know. So they're going to be at our July workshop. So they're going to be our digital navigators. And then they've now created schedules for our Kapuna who want to stay afterwards and meet with them one on one to go
Okay.
whatever they want. How do I
So
use my
first of
cell
all,
phone?
you're making me cry because this is so lovely.
Right?
I love this. And just thinking kind of culturally as well, this is also so important for the teenagers to interact with the kapuna because this is kind of again like a full circle moment of going back to your roots and learning how to speak with people who are not in your generation and how to be patient with people who are not in your these are amazing life lessons for them as well.
Absolutely. I mean, same here. It gives me chicken skin all the time because it checks off all the boxes, right? So we're talking about digital literacy, but what always comes to mind when I describe that program are the exact kinds of characteristics and values that you just mentioned, right? In our society, just as human beings, to be kind. And then you bring in the younger generation learning from not only, the kinds of things like patience and how to ask questions and interact, but our kupuna. I think sometimes it's lost in us on their amount of wisdom that they
Mhm.
can share even with
Yeah.
us. And so, yeah, it's a fabulous program. If you could have seen how excited I was when I met the coordinator, and so I had them present. But so talk about, getting the word out there. And now they'll be in our community next month. And then I have them ongoing at our farmers market to be able to meet folks there, it's an appointment or not. And it's not only open to kapunas, but anyone who needs, has access, but they really don't know how to use it.
Yeah. So yeah, I mean, you're right. Everything is digital, and without that literacy, it's so hard to function. We are running out of time, which is annoying because I want to hear more about all of these things, and I want an update after this training program because I want pictures. I want the whole thing. Maybe just live
Yes,
stream. Can you live stream? No. So I want to, but I want to ask you a bit more of a personal question to finish us off.
sure.
You have been there for 35 years, I think you
Mhm.
said. What keeps you inspired and what are you most proud of in the work that you're doing now?
What keeps me inspired, quite honestly, very simple. Again, born and raised in my community. And so wanting to make sure that everyone around you is healthy, that they have this, and this means the same opportunities that everyone else has. That's easy because I want it. I want it from within my heart, right? I wake up in the morning and I'm excited about, what it is that I can do, who I can meet, who, wants to get together, whether it's grassroots community or outside of. And, I think back to really what the definition of community is and how we all support each other, regardless of, if we're truly blood related. And then reading my proudest moments, I'm going to say there are quite a few, but I'm going to say probably in this more recent in our digital world where I met with folks at different levels, at the White House, at our state level, so both state, federal, or local level. And it never ceases to amaze me how detached our decision makers and our policymakers are from really what is happening
Ground.
in our communities.
Yeah.
And so being able to bring my community's voice with me wherever I go to let people know, hey, these are folks that I've been able to help. I mean, I have real life stories for you where people are not connected. And so it's still a challenge, and we need to address it now. But everyone is moving ahead, and my community is being left behind.
Mhm.
And I'm going to make sure that they're not left behind, because listen, I'm tired of our community being number one in, diabetes prevalence in the state, and then and obesity prevalence on our island. And
Mhm.
I want to be number one in, a connected community, and being able to make sure that our community is not only the healthiest, but also making sure that they're engaged and have all the opportunities that technology can offer, right? So not only us as an organization leveraging technology, but certainly the people that we're serving.
Yeah. And I know you and you will get them there. Like that is the one thing I have no doubts about. Thank you so much for spending time with me today. I think we both always say that every time we speak, we kind of learn more from each other. And I'm so happy we got to record that conversation today and share it
I
with our listeners.
absolutely. Mahalo nui loa. Thank you very much. I always appreciate our conversations. And thank you for having me.
Thank you. If you enjoyed today's conversation, please be sure to follow or subscribe wherever you get your podcasts. Every 2 weeks, we've got new episodes coming out, and you can share this episode with a colleague who's passionate about digital health access or rethinking care delivery. Access Amplified is brought to you by Taito Care. I'm Joanna Brownold. Thank you so much for listening, and we will see you next time.